Intellectual disability. An intellectual disability is a In order to be classified as having an intellectual disability, an individual usually has an intelligence quotient score of 70 to 75 or lower and indicates delays in adaptive behaviors, including social skills, practical skills, and cognitive skills. It has significant impacts on development as well as behaviors. People with disabilities make up a little less than 20% of the United States population. There is no specific way to describe or define intellectual disabilities, as there are countless types and categories. Most of the time, the disability will be genetic. There are, however, some cases in which it is caused by traumatic brain injury or birth complications. Overall, individuals with intellectual disabilities often struggle keeping up in school because of cognitive delays. Most, if not all the time, a child with a disability will be significantly behind in school in comparison to a child without a disability. It is important to find the right placement in school for each child with a disability. I will now speak about the prevalence rates of intellectual disability. Did you know the prevalence of intellectual disability across the world is around 1%? The prevalence is almost 2 times more in low and middle income countries compared to high income countries. Highest prevalence was seen in child and adolescent population. More than 1 in 7 American children have a mental, behavioral, or developmental disorder, according to the U.S. Centers for Disease Control and Prevention, but prevalence is far from steady across the country. At the high end, 21.5% of kids in Arkansas and Kentucky have one of the conditions. By contrast, California logs the lowest rate in the nation at 10.6%. 17% of children in the United States were reported. Prevalence rates vary depending on the study design and the population studied, but according to the World Health Organization, the true prevalence of intellectual disability is close to 3%. Prevalence was higher among studies based on children compared to those on adults. Higher prevalence in low and middle income group countries is of concern given the limitations.
That brings us to warning signs of intellectual disabilities. A typical sign in early childhood is talking, walking, crawling, or rolling overly. Behavioral problems like extreme attention tantrums or trouble communicating. While younger, they may not be an obvious indicator of an intellectual disability, but as they get older, it can be noticeable. Simple things such as logical thinking or problem solving can be difficult. School-aged children may have difficulties learning vital academic skills such as reading, writing, and math, as well as functional use. After assessing in comparison to other same-age children, developmental milestones may not be reached. They will increasingly have trouble learning in school and may not fit into social norms. Individuals will be slow at mastering simple tasks in or everyday routine and could be easily manipulated and have immature social skills. Children with profound cases, there are usual additional health problems that can include vision and hearing seizures or mood disorder. There are varying degrees of intellectual disability from mild to severe. These signs aren't concrete and can vary, but be aware and mindful of them.
pressure to realize. Also important to know is that help is available. There are many services available for those with disabilities. There are family and individual support groups, help for adults with daily living needs, support for people living in the community, help finding a place to live, legal advice, specific help with individual cases, and specialist health care. Now that it's available, it's important to know where to get help. You can receive help from your doctor, local council, local community health center, maternal and child health services, Department of Human Services Regional Office, or a Disability Intake and Response Service telephone at 1-800-783-783 or by text telephone at 1-800-008-149. More important things to remember. Intellectual disabilities are common. There are 3 million U.S. cases per year. That means, as a teacher, you may come across a student with an intellectual disability. That is okay. People with an intellectual disability are able to be independent and enjoy usual life experiences. And there are many resources available in the community to help these individuals lead